significant benefits were not seen. And so that group of so-called seronegative or double seronegative patients, if they're also log negative, remains somewhat mysterious and certainly very heterogeneous. What I'll show you in this series of slides is sort of an overview of an estimate of how effective these drugs might be, with a lot of caveats about the interpretation of the data. So I'll walk you through 4 sets of bar graphs. The first is, what were the annualized relapse rates before patients were treated with off-label therapies? Well, they were typically between 1 and 2 relapses per year. These were in observational studies, before and after studies, where patients were presenting to clinics, having had a number of attacks in the last few years, placed on one of these therapies, and then observed for a period of time. So somewhat more than 1 to a little bit greater than 2 relapses per year. And then after treatment, that annualized relapse rate dropped to anywhere between about 0.25 and 0.5 per year. Again, these are uncontrolled observations. Then came the randomized controlled trials, and these 5 bar graphs here show the annualized relapse rates of the placebo or comparison groups in 5 different studies. So all of the studies that I just mentioned, the pivotal studies that led to the approval of current therapies, as well as the RIN1 study of rituximab. So a couple of these studies